Hello, my name is Alex Armstrong. I'm a consultant plastic and reconstructive surgeon based in Plymouth. I work at the University Hospitals Plymouth NHS Trust and also have a private practice in Nuffield, Plymouth. I think I've always been someone who likes to have a plan, and I was always destined to do a vocational career, always drawn towards the sciences, but also having the opportunity to interact with people and get to know people, not only in their medical sense, but also on a personal level as well, to really understand what the best kind of treatment plan would be for them. So in a nutshell, I just enjoy spending time with people. I feel privileged to be able to ask them, important questions and be part of their care pathway. Plastic surgery, I think, is a fantastic specialty because you get the opportunity to have quite a general practice. You operate all over the body and both operate and work with children and adults. It's also a unique specialty because we drift between different specialties. I often work with orthopedic surgeons, dermatologists, neurosurgeons and cardiothoracic surgeons, for example, in the trust, because we offer some unique reconstructive skills that can help fundamentally get wounds healed with challenging cases. It's something that looks at form and function and also the cosmetic aspects of surgery, combining both science and sort of artistic skills, I guess. So it's a really very specialty, and I think every case is different and presents a new and unique challenge. I think the most rewarding is following a patient through their journey, seeing them when they're potentially at their lowest ebb, whether that might be with an injury or a new diagnosis potentially of cancer or something like that, where you have to really get to know the patient and get their trust to be able to treat them effectively, and then following them through that initial surgery phase and the recovery phase and reconstruction, and that I find that incredibly fulfilling. But I think the personal level of understanding and getting to know a patient and ensuring that you're doing the right thing by them, I find is really satisfying. And obviously, I enjoy being in theatre. I love the buzz of theatre. I like how gratifying that is, the reward of it, and getting to work with lots of fantastic people along the way, both anaesthetists, nurses, and other surgical specialties. I think patients would mainly say that I spend and take the time to understand their concerns. I think it's very easy, especially in the NHS nowadays, to feel time pressured and rushed. And actually, you need to spend good time with patients to be able to understand their condition, understand their needs, because those things sometimes are different, and you need to make sure that you're meeting their expectations. So I think communication, gaining trust, and I hope that they think that I'm a skilled surgeon, and they think they're in good hands. So that's what I kind of most value from my patients, is that trust, and hopefully they feel that they can trust and me, and I communicate well with them, making sure that they understand the process. And something that's quite daunting and sometimes complicated, I break that down into hopefully more accessible language, something that's more appropriate for the lay person. And that's also important with children as well. So I'm able to hopefully temper my language and also meet the expectations of children and their worried parents.